Welcome, welcome. I am Alfonso Monarres, and I'm very happy to have you here today. We invited the camera so that you can learn about the implant process for full mouth reconstruction. We've been doing this for a long time, and we're pleased to have you here so that you can understand the process of what we do here in our office. You're gonna meet our great team of wonderful people that help me make this happen every day. Also, you're gonna meet our patients. We're gonna show you how to make the teeth, how we make the teeth in this facility, and it's gonna be wonderful that you guys can be with us today. So why don't you follow me, and we're gonna start here as you walk in, and let me introduce you to these ladies that help me do what I do every day. Here we have Jenny. She meets all the patients and she is amazing. And our office manager, Barbara, who makes this place run and makes sure everything works properly in this office. So why don't you follow me and you get a chance to meet them later. By the way, I love this picture. You're gonna see a lot of art in our office, but this picture is one of my favorites. By the way, Yesenia, my wife, who designs the teeth and makes them beautiful for all our patients, also paints all the art in our office. And one day when I was treating a patient, she just saw me there and decided to make this painting. It means a lot to me. You're gonna see it as you walk in the office. All right, so let me take you in the rest of the tour. Why don't you follow me this way? All right, so this is where we start. And we know the dental implant process can be scary for people. So when patients come here for the first time, they're gonna meet with Jenny, and she's amazing at listening to what concerns you. It's a free consultation. She sits with you. She understands your needs. She's wonderful, trying to find a way to help you. I know that this can be a very difficult thing for some people, but we try to be compassionate. We try to listen to what is important for you, and we're gonna do our best to make sure we meet your needs. As we're walking by these hallways where we see transformations every day, you're gonna see some of my wife's Yesenia's art. In this hallway, in these rooms, every single day, we see transformations. Patients come in the morning, with a lot of concerns, and then they walk out of here with a beautiful smile. But it's a lot more than just that. It's the beginning of their new lives, and we are very passionate about it. So let me show you this room, because this is very important. This is where some of the technology that we use plays a very important role, because without this, we couldn't do what we do today. This is where we scan the patient's faces. This is where we take our cone beam CT, tomography that allows to measure the bone. Here we can see the patient's faces, and we can put them together accurately. So when we're making the teeth, there's no guessing, It's like having the patient in front of us. We can see their eyes, we can see their lips, we can put the teeth in the perfect place and choose the best for every human being. And thanks to this equipment, we can do what we do every day that we couldn't do before. Why don't you follow me to my office? And as a prosthodontist, I can get that out of my heart and my brain, and this is where I sit down, I plan all the cases. We have some equipment here for 3D printing that helps us make the teeth in a very sophisticated way.
I always wanted to eat like everybody else. I loved apples, carrots, everything, but I had to cut up everything I ate because my teeth were so bad before, they would break off. I was told by numerous dentists and oral surgeons that my only option was going to be dentures, but I knew that was going to work for me. I couldn't do that. So then I had a friend who recommended Dr. Monarres, and I still came in skeptical. I was like, it's not gonna happen. But he looked me straight in my eyes and told me no matter what, he would get me there. I could have a smile again. I could be confident again. But now I can eat corn on the cob, apples. My favorite is candy pecans. Everything is better. Confidence, laughing. I'm okay to laugh in public with showing my teeth. Before it was always hand over the mouth, cover everything. It's amazing. Pictures, I love to take pictures now, and I never did before. The only smile you would ever see would be the love instead of the smile. You have to love yourself enough to give you something that makes you confident, because only you can do that. Well, and Dr. Monarres.
All right, so let me continue with this. In a normal day, we have lab technicians making teeth. We have our assistants, our staff, making sure every patient is well taken care of. We do surgeries in these rooms. We make the teeth in these rooms. We follow up with our patients that are completed in these rooms. We have an evaluation area where patients are gonna get all the required diagnostics. Now, I really, really want you to meet Jenny, because this is the person that you're gonna meet the first time you come here. She's gonna listen to you and make sure you're very well taken care of. Jenny may be a little busy right now, but there she is, Jenny in her office.
So my role is to help you through the whole process. Most of us have the same questions. How much is it going to cost? I'm going to help you through that process. If there's going to be difficult through the procedure, downtime, even pain, I'm going to walk you through the process of all of that and answer every question that you could have, so you leave here knowing what to expect. Most of our patients finance this procedure. We walk you through the whole process here. I can help you through the financing, answer any questions there may be about the financing. Unfortunately, insurance doesn't really cover the procedure to a great extent. However, we have a lot of ways to make it fit comfortably within your budget.
All right, and I really want to save the best for last. Very often people tell us, why do your smiles look so good? I mean, the people that we treat look really, really good. And I think one thing that is very unique and gives us an advantage is that I married a wonderful lab technician that happens to be my beautiful wife Yesenia. She makes all the teeth. She puts her heart and all her art and talent into every case, and she is working right now designing another smile. This is where she works, but we're going to have a sit-down interview with her later, and she's going to explain the whole process of what she does in a minute. So my favorite part of the process is to see the transformations of my patients. So I would like to share with you some of them so you can see what can be done, right? And the first lady I want to show you is this person that came to me because she had been wearing dentures for many, many years. Unfortunately, she got the teeth that didn't last forever. Yeah, we don't get to choose what we get from Mother Nature, and some people try really hard, but they lose their teeth. And for centuries, the only option was a denture or nothing. Neither one was really good. Nobody likes dentures, but that's all we had. So you can see she's wearing a denture right now. And what did we do for her? We did an upper and lower set of dental implants and beautiful new teeth that changed the way she looks completely. Look at the separation of her lips. Look at the shape of her lips. I call it the frame of the smile, right? She was covering those dentures. She couldn't really eat with them. They were just for show. Dentures look like teeth for the rest of the world, but they don't feel like teeth and they don't work like teeth. You know that if you're wearing a denture. And now she can eat anything she wants. She looks a lot younger. Look at her expression. She looks happy. She looks sophisticated. She looks feminine, elegant. And it's just because we put the teeth in the right place, anchored by the implants in just one day while she was sleeping, comfortable. And she's now, happy. Everybody wants to be around her. She's glowing. Let me show you this one because it really warms my heart. This gentleman is the nicest person that you can imagine, but look at the before. He had severe wear. His jaws didn't align very well. And I told him one of my best jokes, and he's laughing, but you can even see the separation of his lips because of the collapse. So people around him thought he was an angry person. And we decided to give him a full upper and lower set of dental implants. But now look at the side by side. Wouldn't you say he looks more handsome now? That he looks happier, younger? I mean, he almost looks like his younger brother. I don't know what he's doing today, but the truth is you might see him at a steakhouse enjoying a wonderful piece of steak and having a wonderful time in his life. He can eat anything he wants now.
My teeth were so bad that I didn't smile. I would be on Zoom calls and I just definitely wouldn't smile. So I would talk without smiling. I couldn't eat peanuts and salads. I thought I was going to choke every time I ate a salad. So I was just so happy when I got my new teeth that I was able to chew peanuts, eat salad without praying that I was going to choke, and eat steak and everything else, anything that I want to eat. An apple, I could take a bite of an apple. That was just wonderful. When I saw my smile for the first time in the mirror, I teared up because I was just like, wow, I can smile again without thinking, who's looking at my teeth? Now I can smile again and say, look at my teeth. So it was just very emotional and it was life-changing. So I feel like I'm back to the old me. My charisma's back. I can smile, I can be me, I can laugh and open my mouth the way I do, and just because I'm a person who's high-spirited. So I like to laugh and joke, and now I can fully let that go. I think this is the best money I've ever spent. If I had to do it over again, I would definitely do it over again. So I can tell you what's expensive. The teeth were, I had to pay for those, but going out to eat all the time and being able to order everything on the menu, that's expensive. And then, now the freedom to travel, go to any restaurant all over the world that I want to. and be confident to smile. It's just awesome feeling.
The next gentleman, it's a great story, you know, retired man. He was having issues with his teeth, like many other patients that are genetically predisposed to have disease. Dental implants was the best for him. And one day he came here and we changed that smile. Look at the before and after now. I mean, he didn't look bad before, but he looks really good as a bonus, of course, but now he can eat good food. And for him, to be honest, the most expensive part of this procedure is going out to restaurants now. He can stop and all the traveling that he's doing. So let me show you another one, okay? This is another great story. This lady had a good dentist, believe it or not. Actually was referred to me by her dentist, who's a good friend of mine, and she was going all the time. But she couldn't stop having cavities. Look at the way she looks. She smiles now proudly. She can be herself. We replaced her teeth with dental implants because there was not much we could do with her teeth. Wouldn't you say she looks a lot better, right? But guess what? Of course she does, but that's everybody. You know, teeth make people look a lot better, younger, happier, smarter. They just glow, right? And Yesenia, my wife, is an expert in making all our patients look amazing because she takes care of every single detail. She customizes every smile to make sure our patients look wonderful.
You know, I didn't like my teeth for about 20 years. I was in the medical field and I would always cover my mouth. I was told by 3, maybe 4 dentists that I needed dentures and even partials. There was no way that I was going to wear a denture. Absolutely not. I needed that smile that was going to make me feel absolutely beautiful. When I saw myself in the mirror for the first time, I was like, oh my God, I look so much younger and better. And for people to come up to you and say, you look so much better. I'm like, oh my God, I look younger, so I guess I'm just going to go with it. But it's because of the teeth. It's because of the smile. It's because of what they gave you back that you had been missing for so many years. To be able to eat a salad with croutons and tomatoes and onions and then be able to taste it, because if you have partials in there, the metal plates doesn't allow you to taste the food the way it's supposed to be. I'm 62 years old, and you don't have to be young, old, or indifferent. Get it done. It's something that is life-changing for you and for your health. You're going to be able to smile a lot more. You're going to be able to enjoy life and go out and share it with other people. A smile goes a long way. And when you're out there smiling with other people, they see that. And so money should not be, when it comes to your health, it should not be something that you have to worry about. Yesenia is absolutely so precise when she sees your smile to know what she's going to do to match up to you as an individual. So she is so unique with each one of us that comes in or does what she needs to do, that she is so unique in making sure that we have the correct smile that fits us.
Hello, welcome to my office. This is Yesenia Monarres, and I'm the person in charge of creating and designing the smiles for our patients. I'm gonna show you a little bit of what I do here. I actually have 3 offices. I work from home in the back, but this is my main office where I create and design the smiles for our patients. I hand paint. We have the milling machine here, and this is a computer where I design all the cases. So the way it's actually done in implant dentistry, it's the dentist will send the case to a lab. They're usually not together. We have the luxury here of doing everything under one roof. I get to meet the patients, I get to know their story, and based on that, we can create a beautiful result for them. There are, I think, many factors involved in the process of creating the perfect smile for that specific person. It is a unique art. I think it involves design elements beyond the teeth. It's about matching the smile to the entire face and to the whole person, so we can create the perfect smile for them. And this is why we custom design every smile for our patients, to help them look and feel years younger in body, mind, and spirit. Men teeth are very different in the way I design when it's a woman. They're more masculine, square. When I'm designing a smile for a woman, it's sexier, it's rounded, it's more feminine and delicate.
Let me show you the next case. This gentleman came to us saying, I spend so much time and money in the dental chair, and dental implants are actually a great option even for patients that smoke, even for patients that have gum disease, even for patients that have a lot of cavities. It's a great option, and the success rate is amazing. This is the transformation. Look at that. He is incredibly happy now. Let me show you this next case. Look at the before and afters, right? And a lot of people have told me, and I can see it, that she could almost look like her younger sister, maybe even mother and daughter in these pictures. Look at the transformation. I mean, this is a wonderful lady, smart, sophisticated, and she was heading to dentures. She's too young to be in dentures. Everyone's young to be in dentures. Nobody should wear a denture anymore. George Washington had a denture, and for 300 years, people kept getting dentures. There's better options for people than that. Look at her. I mean, amazing transformation. Let me show you this case. This lady only had one tooth touching in the back. You can see it in the before picture. And now, once the health is back, we create beauty, right? We can put things in the right place. Not because we want her to be amazing and beautiful, but because if we do everything, we put things in the right place, everything functions better. She gets her health back, she has optimal function, and of course, she looks beautiful. Cases like this in other places require the intervention of multiple doctors, multiple surgeries. They go to the surgeon, they go to the dentist, a lab is involved, they go to an imaging center many times, and all together, after many appointments, takes probably, 16 years and a half, 2 years of treatment. Here in our office, because I do everything with my lovely wife and my staff, patients get treated in one place in a very short amount of time, and they get these magnificent results.
My teeth were really bad. It was hard to eat anything but pureed foods. Dr. Monarres and his wife were on TV, and it got our attention. Our daughter was eating the same things I was. It was all soft meals.
Yes.
She grew up with a lot of dental needs. This was a wonderful thought to get in here and talk to Jen and find out that both of us could get a new smile. And by the way, Janelle never smiled. For years and years, she wouldn't smile. She'd close her lips, and you'd only wish there was a smile. Now we can't stop her from smiling. So we're pretty happy. She ate an apple for the first time just several days ago. She thought that, she said it's not poisonous, kind of like Sleeping Beauty. It's not poisonous because she's never eaten an apple. I wish we would have done this years ago. I think I've wasted years that we could have eaten better and gone out to eat and smile. You can't stop us from smiling now. We're excited.
Yeah.
I don't know if I like the way it looks or what I can eat better, but I enjoy them both. I enjoy the smiles and I enjoy eating.
Both.
Yeah, if you're thinking about getting this implant, go for it. It's well worth it. Don't hold back.
I like meeting the woman especially just because when I see the final result, I see a big change in their confidence. They color their hair, they come here wearing lipstick, and just that confidence just shines through their eyes. So it comes out of the milling machine, and I spent my time carving it by hand because every patient's different. Now, you have to make sure that every smile is unique. And I can see it from all angles, and that's the amazing thing about this system. It lets you create beautiful things, and especially because, let me show you, you can have the patient, the picture of the patient, and it's just like having the patient here.
Oh, the next one really warms my heart. This is a really good story. I'm gonna make it really short. Again, she's biting down. She could only touch in one tooth. Look at the before and after. We did a upper and lower set of teeth with anchored by dental implants, and we are able to control all her teeth, put them in the right place, give her the right bite, and she's so thankful, so grateful. She feels better, she's healthy, happy, and it's a wonderful story that warms our heart. All right, let me show you the next case. This lady came to us. She had been seeing a dentist for many years, and she was complaining because of her appearance. She had many cavities. That happens very often later in life, you know, when we change, when the bacteria in the mouth changes because of age. We were able to replace her teeth instead of fixing her teeth. No more patchwork. We gave her a brand new set of teeth. Look at her smile, right? And she's super happy. And my staff, we all work together to make sure patients walk out of here with exactly what they want. All right, next case. This lady was heading for a denture. Great story. She hated partials, she hated the missing teeth, and wish I had more time to tell you the full story, but you're gonna hear from her. Look at the before and after, beautiful result.
Really, my teeth was really bad, and for many, many years I was losing my bottom part of the teeth. And when I go to some places and I have to smile, I will do. That's it. And after I met Dr. Monarres, was kind of, oh, it's an angel to my life. I mean, I got my smile again, my confidence, and I was able to eat whatever I want, which before I can't. And now I can eat an apple, I can eat a corn, I can eat everything that I want, and I enjoy my food, and not worry about where my teeth is going to be. And I'm feel good. I mean, I'm getting some weight because I'm eating too much, but that's okay. I didn't do it before. I enjoy it right now. Now people compliment about my teeth. First time that I went to the office, we showing my beautiful teeth. People say, oh, you are so young. You have a surgery or you have something in your face. I said, no, I have my new teeth and I can smile now, which I never did before, but I never laughed before. Now I can laugh.
Teeth were like a train wreck. And so it was like, well, and then they wanted to remove it and put some other dentures in. And I just didn't need that anymore. This smile, when I saw it, it was just so beautiful and so natural. That's the other thing about it. It was natural. It wasn't something that looked fake, because I saw so many false teeth that looked like horses' teeth that I thought, no, I don't want that. I like eating apples that I couldn't eat before, even with all the other contraptions that were in my mouth. I couldn't eat them until now, because I had to cut everything up to eat an apple. So now I just chop. Went to a rally with my daughters. And, you know, these people had seen my daughters before and they had seen me. And then one of the ladies there turned around and asked my daughter, what happened? What had your mother done to herself that she looks so much younger? And it was the smile. It was worth the money. It's the best money that I've spent. I mean, I was so conscious of my smile that it worried me. And so this was the best money I ever spent.
You know, we always get these questions. Does my insurance cover this procedure? Does Medicare, Medicaid cover these procedures? And unfortunately, they don't, right? They cover replacement of teeth with the other solutions, like a denture. I'm being very honest with you, the majority, more than 75% of my patients finance this type of care, this type of treatment, and it's a very normal thing, and we help with that process. Let me show you this next case. This is a patient that was suffering from a lot of problems with his teeth, and he was heading to losing his teeth and dentures, right? We replaced his teeth with dental implants. We gave him a brand new smile. We corrected the position of his teeth instead of breaking his jaw, and now he looks happy, he's excited, he's just a different kind of person. I don't like snap in, snap out dentures because patients don't like them. You know, they're still a denture, covers the roof of your mouth, they can feel temperature, taste the food, and you know, I just want to make sure people ask before they get treatment, because sometimes they go for dental implants and what they get is a snap-in or snap-out denture. This is totally different, doesn't cover the roof of the mouth, is fixed from day one, feels, functions, and looks like natural teeth again, and they'll never have a cavity, or they'll never need a filling or a root canal. It's just totally the best thing we can do in dentistry for patients that have teeth like this. You're gonna meet this guy today. He's gonna tell you his story, but I want you to see, the difference. And look at the before and after. In the before, his face looked rounder, right? He looks a little bit older, and now his face looks really good. I bet he's eating a lot better, and his self-confidence went to the roof.
My teeth were really bad. They were grounded down to the point where I didn't want to smile. And then one day in my sleep, I snapped off my front tooth and I couldn't smile anymore. I couldn't open my mouth. I was embarrassed. They're bad. I didn't know what I was gonna do, and I did not want to have dentures. Now I have upper and lower teeth, and the day I walked out of here with my permanents, I went to the first steakhouse I could find. I ate corn, I started taking photos, I looked up photo places, and I took family photos with my kids. If you don't like your teeth, you have to make that leap. I was so scared to do it, but after I've got it done, it's life-changing. When I eat food now, I don't think about it. When I eat steak, when I eat tacos, any kind of meats, I don't think about it. Corn on the cob, it's secondhand. It just comes natural. I don't even think.
My teeth were very bad to the point to where I didn't eat anything that I had to pull on, bite down extremely hard on, in fear of something going wrong or one coming out or breaking a tooth. First time that I saw my teeth in the mirror, it took a minute or two because I had tears in my eyes from what I saw from the very beginning. It has made me healthier. I don't have to worry about when I go to sleep what kind of pain I'm going to deal with through the night. Overall, I'd do it 20 times again if I had to. I think I smile in my sleep, but I don't know that.
I'm really glad we brought the cameras today to show you what the process of dental implant transformation is all about, right? I want to invite you to come in and talk to us. If you're suffering at home, if you are thinking that there's no hope for your situation, if you have been hiding, one thing that I learned in the past few years is, people were wearing masks. And for some, it was a miserable time. For some others, most of my patients, it was great because they could go out and hide and nobody could see their problems. Masks are coming off now, and now they don't know what to do because their teeth are showing again. There's a solution for the problem, okay? This can change a lot of things in your life. If you're looking for hope, if you are not happy with your smile, for all those patients that have no teeth at all, and they're suffering with dentures, that have disease, gum disease, lots of cavities, want to look younger, happier, healthier. If that sounds like you, what I just mentioned, I invite you to come for a free consultation. Let's sit down, talk about your situation. I'm here to help you. And I'll be honored to be part of your life transformation.